Right from morning, you are listening different talks, few topics on neurointerventional radiology. Then we had something about regulatory aspect in diagnostic radiology by the ARB faculty. Then we have seen a talk on radiotherapy. Now, I am going to talk something unique one and different one. You know that we do take CT scan and MRI. For the normal anatomy, it's fine, but when you have a moving system, how to capture that? For example, heart is a moving system, moving organ. I want to capture the data of that. How to do that? So it is difficult because in radiology, when we take an imaging, patients should be still, no movement should be there. If movement is there, how we are going to capture the data? That is called as gating mechanism in CT and MRI. First, I would like to bring our greetings from our institute. I come from an institute called the Sri Ramachandra Institute of Higher Education and Research. It's located in Chennai in Tamil Nadu, along with ISRT. So greetings to all of you. How the ECG gating mechanism works in CT and MRI. So the idea of this talk for 20 minutes is, I'm going to highlight you how actually we capture the data of a moving system, organ. Some of you might be working in CT, you'll be doing a cardiac CT. Some of you might be working in MRI, we might do a cardiac MR. So how to capture that? Not only that, we also have a respiratory movement. Then how to capture the data, bowel movements. So all these things I'm going to cover in 20 minutes. Why gating is needed? Gating means it is something like synchronization. See, for example, if my friend is traveling in the train, if I am going to sit next to him, I can see his face clearly. Suppose if I stand in the platform, he is going very fast, train is going very fast. Is it possible for me to see the face beautifully? No, because he is moving in different speed. I am in the platform, in the standing actually, so I may not see his face clearly because train is moving 100 km speed. So now what I have to do is, similarly, when I am going to image the moving organ, I should synchronize. How to synchronize? I am going to apply the X-ray beam to capture the data. That has to be synchronized with the movement. That is called as gating. Gating is an essential part. If you look into this, gating is an essential part of cardiac CT or MRI to overcome the blurring of images caused due to continuous heart motion as well as pulsatile blood flow. Wherever you have a pulsatile blood flow, there also the image will be blurred. How to overcome this? There are different types of gating mechanisms are there in CT and MRI. One is called as cardiac gating. Next one is called as respiratory gating. Then we have something called as pseudo gating. Cardiac gating, respiratory gating, pseudo gating. Cardiac gating is classified into two divisions. One is called as ECG gating. With the help of ECG, I am going to do that. Other one is called as peripheral gating. I will take 3 minutes or 4 minutes for each one and finish it off. First one is ECG gating. I am going to fix the ECG leads and I am going to get the ECG pattern. With the help of that I am going to do. Peripheral gating means I am going to use a photosensor like our pulse oximeter. We are going to use and we are going to get that. In detail I will tell you later. Then I am going to have a respiratory gating. You know that when the inspiration, expiration, when you do respiration is going to happen, isn't it? So that is the third type. And fourth one is the pseudo gating. Pseudo gating means it is not a real gating, which I will explain you in detail. Okay, let us go to the first one, ECG gating. First, you should understand the normal ECG pattern. I request all the technologists present here, you should be familiar with this. You know that the ECG pattern looks like this. The main component which you should understand is P, Q, R, S and T wave. What is P? P represents the arterial systole. You have the two types of contraction, systole and relaxation diastole. So P wave represents the arterial systole, Q, R, S peak, this is the complex one, QRS complex represent ventricular systole, that is the left ventricle contraction. Then T wave represent the ventricular diastole. So this is the basic normal ECG pattern, all of you are familiar with this. Here, what actually we are going to do is, these are all moving one, but can you see this flat one? This is called as rest phase. Rest phase means movement will not be there. My idea is, I have to acquire the data during that rest phase. That is called as synchronization. How I am going to do that? Have a look here. For that, you should understand what is RR interval. The time between the first peak R and the second peak R is called as RR interval. RR interval. You know that normal heart rate is 72 beats per minute. 72 beats per 1 minute is 60 seconds. So 72 beats per 60 seconds. If I want to convert that into millisecond, 1 second is equal to 1000 millisecond. So 60 second is equal to 60,000 millisecond. So what is the message? For 72 beats, it takes 60,000 milliseconds. Then for 1 beat, how much? 60,000 divided by 72, that is 833 millisecond. Remember, for a normal heart rate of 72 beats per minute, the RR interval will be 833 millisecond. Don't forget it. 0.8 second we normally say, exactly it is 833 millisecond. In this 833 millisecond, the rest phase will be around 250 millisecond. That's all. It will be around 250. I am telling approximately 250 millisecond. But you know that in CT scan, the X-ray tube rotates 360 degree. It takes minimum time is 0.35 second. That is 350 millisecond. What is the time for X-ray tube in the high-end machine? 350 millisecond is the rotation time. It is possible only in 64 slice CT scan. Less than that, 2 slice, 4 slice, 8 slice, 16 slice, 32 slice. You will have a speed only of 0.5 second, but 0.35 second you will not get. 350 millisecond you will not get. So in which CT you will get? Minimum 64 slice CT you should have. That is the reason when you want to do a cardiac CT scan, you need at least a 64 slice CT scanner. Because here it is only 250 millisecond, my gantry rotation is 350 millisecond. Then what will happen? So it will be overlapping this area and this area, so movement will come. So we cannot do a cardiac CT. So what actually we are doing is, we are trying to reduce the heart rate. What we do, we give beta blocker to the patient, so the heart rate will be reduced. What is the advantage? Why we give beta blocker? Why we have to reduce the heart rate? For a simple reason. Have a look here. If it is 72 beats per minute, my RR interval is 833 millisecond. My rest phase is only 250 millisecond. But when I give the beta blocker, my heart rate reduced to 60, for example, my RR interval will increase 1000 millisecond. Between this peak and this peak will be 1000 millisecond, and my rest phase will be something around 350 or 400 millisecond. So now I have enough time to capture the data of the moving heart in the rest phase. That is called as gating mechanism. So what I am going to do is, I am going to apply the X-ray beam on only in this area, flat. Can you see it is flat? Rest of the things are moving one. This is the rest phase. So by decreasing the heart rate, my RR interval is increased, and this flat place is sufficient for me to capture the data. So this point you should remember. Here in ECG you have to understand, you see this is the peak wave. This is the rest phase, I am going to acquire the data. After this, I should not acquire the data till the R wave is sensed. That is called as trigger window. The trigger window, that is after acquiring the data. This is the rest phase, I am going to acquire the data. After that, till the R wave comes, I should not do the acquisition. That is called as trigger window. That is the waiting period before R wave is called as trigger window. Then, after getting the R wave, peak wave, after that also I should not do the X-ray on. Acquisition should not be done, because You see this wave, T wave, in diastolic, that is going to be there, movement is going to be there. I should not do the acquisition here. That is called as trigger delay. So what is the acquisition time? When actually I will be capturing the data of cardiac movement at this place only, rest phase. That is, this is R, called as RR interval. This portion, trigger delay, I should not capture the data. This portion, that is the P wave, that I should not capture the data, that is trigger window. Then what is available imaging time? Available imaging time is RR interval minus trigger delay plus trigger window. That will give the actual acquisition time. Only this area I am going to do the scan. So only that area I will be giving the X-ray and capturing. Heart is at rest phase. No movement will come. That is called as gating mechanism. There are two types of gating, prospective and retrospective. Prospective means directly you are going to do. Retrospective means retro means later on. So how we do in cardiac CT, how we do in cardiac MRI, both I will tell you. In cardiac CT, cardiac CT prospective gating means, can you see, this is the rest space, this is X-ray beam is on. Only this portion X-ray beam will be on. How? After sensing the R wave, it will wait, trigger delay will be there, it will wait, then it will do the scanning. Next RR interval, table will move, because for the next slice table has to move. So no X-ray. Then after that X-ray beam here, then X-ray beam here. Like that we will occur. That is called as prospective gating. What is retrospective gating is, continuously X-ray will be on. I will be post-processing only the rest phase here, rest phase here, rest phase here. So only the rest phase I will post-process and take the data. But what is the difference here is, in retrospective, the radiation dose will be higher when compared to the prospective gating. Prospective gating, I am exposing only this portion. So the radiation dose will be 1/3 approximately. But in retrospective, completely I will be exposing, and post-processing I will be capture the rest phase. But most of the institute, do you know what they follow? They follow retrospective because it is easier. Because for the various patient, the heart rate, movement, everything is going to vary. It is difficult to capture that. But it can be done, but most of the people carry on the retrospective gating. So this is about cardiac CT. How they do it in MRI? In MRI, what they do is, you know this is the rest phase. During that time only, radio frequency pulse is applied. I hope some of you will be working in MRI. MRI, the main component what we use is a strong magnetic field and radio waves to capture the signal from the patient. In case of CT scan, we apply X-rays. But in case of MRI, we apply RF pulse. When we have to apply RF pulse? During the rest phase. So similarly, when I am going to apply the RF pulse and get the image in the rest phase, that is called as prospective gating. Suppose if I am going to acquire the data continuously and I am going to do post-processing only in the rest phase, that is called as retrospective gating. Both the things can be done. And in case of MRI, you have two options, T1 weighted, T2 weighted. There are two types of images are there. For T1 weighted image, every RR interval I will acquire the data here, I will acquire the data here, I will acquire the data. That is T1 weighted image. T2 weighted image means I acquire the data here, I will not do here, I will not do here, I will do it here. So I will be skipping two RR waves so that I will be giving a gap. So you know that in T2 weighted image you should have a long TR. So that is the reason we give gap. So this you who is working in MRI will be able to understand. If you don't know, leave it up, don't worry. But have an idea, prospective means applying RF pulse in this area. Retrospective means full area you apply RF pulse and post-processing you do in this area. So you will not get any movement artifact produced by the cardiac motion. That is called as gating mechanism in MRI or CT. We are using the ECG pattern and you are going to acquire the data so that blurring will not be there. So this is one. Now next one is the peripheral gating. What is peripheral gating? Like this pulse oximeter, you will have a device called as peripheral pulse. What it will do is, see here we have a photo sensor. Okay, this photo sensor attached to the patient finger, this will detect the blood volume in the capillary bed during the systole. During the systole, the blood flow in the capillary bed will increase. So that it will capture, and that will be given as a, and that will be displayed as a graph. See, can you see, this is the maximum blood flow in the capillary. Then it comes down, rest phase, increases, rest phase, similar to ECG. Here what we do, with the help of peripheral gating, we will give X-ray or MRI RF pulse in this region, rest phase, similar to the ECG pattern. There we use ECG, here we use peripheral pulse. How we get the peripheral pulse? Put the peripheral pulse unit here, photo sensor is there, photo means light, photo sensor is there. The capillary bed blood flow, when it increases during the systole, it captures the data, so peak goes. When the systole is completed, peak comes down, rest phase, once again it increases, comes down. That only you are seeing here as a wave. Okay, in this region, in this region, in this region, in this region, I will apply the RF pulse and get the MRI information. So no movement will be there. This is called as peripheral gating. The next one is called as respiratory gating. Inspiration, expiration, isn't it? Movement is there. I want to do a chest imaging. I want to do an abdomen imaging, particularly chest imaging. I have a respiratory gating. I have a bellow which produces this. So can you see it? This bellows in the middle portion. It will expand and contract. Inside there will be a detector will be there. It will expand, contract. During that time, it will produce the signal similar to the peripheral gating. In this portion, this is the rest phase, I will be applying the RF pulse and I will get the data. See how beautifully in ECG, rest phase, by using peripheral gating, rest phase, by using the respiratory gating, you have a rest phase. So you are going to synchronize this gating and you are going to apply the X-ray or RF pulse in case of CT and MRI, so that you will not get any movement artifact, no blurring will be there. You will get a pakka image quality. So that is the idea of having a different types of gating. So can you see here? This is the respiratory gating. You are going to acquire the data in this portion. Application, I think overall working in MRI, there is a procedure called as MRCP, isn't it? Pancreatography, when you do for the gallbladder study. When you apply the gating, respiratory and see, beautifully you can see the margin of the gallbladder. If you don't use the gating, the image will be blurred. You cannot see the CVD and the vessels so beautifully. That is one of the greatest advantage of the gating mechanism. Last one is the pseudo gating. Okay, pseudo gating means I'm not going to do any device. I simply connect the ECG leads. What is going to be displayed on the monitor? ECG pattern. I know this is R wave, another R wave. What is the R wave distance? I can measure it and I will apply roughly in the rest phase X-ray beam. Then it is called as pseudo gating. Roughly, I am going to apply that. So that is called as pseudo gating. Pseudo gating is a very simple method that involves selecting the TR. That is, in MRI we use TR as a parameter which matches the RR interval. It is something like a crude method. That is called as pseudo gating. Okay, I think I have finished within 20 minutes. So what is the conclusion is, please remember there are different types of moving systems are this in human system, which we call it as involuntary movements. If I am keeping my hand, it will be stationary, still it is voluntary movement. Heart, you cannot make it to stop or move. It is an involuntary movements. When you want going to image the involuntary movement, gating is the process in which the scan time is determined by the patient heart rate, and it is useful in reducing the motion artifacts caused due to gating, cardiac or respiratory movement. You understand? So this is the message I want to give. Gating mechanism is a wonderful tool in imaging the moving system. A message, of course, there are no students, I think it is only staff, but even then we also can learn. A beautiful quote, lot of quotes are there by Kalam. Confidence and hard work is the best medicine to kill the disease called failure. So all of us think of failure. See, we had a COVID. All of us got a failure. All of us have failed the COVID. We are not going out. We are not able to see friends. No, now we had a confidence. We fought that. Now we are happily seeing each other, isn't it? After 2 years. So this is the best medicine for the for the disease called failure. So by doing that, the confidence. Do you know what it will make? It will make a successful person like all of you. Thank you very much. Thank you.